Hello, friends, and welcome to another episode of Chai Talk for the Left Hook Substack with Witch Hutley, where I invite a subject matter expert who's far smarter than me to break down one big question in 30 minutes or less. And today I have ProPublica's investigative reporter Eli Hager with me to break down a really sobering, chilling, and pretty frightening story recently published in ProPublica about the Trump administration's war on children. And I will link to it in the write-up, but specifically these DOGE cuts and, making the government more efficient and, right, saving us money is coming at the expense of our children. And apparently, the Republican Party, which is so pro-family, right, so pro-kids, is perfectly fine throwing our kids to the wolves with these devastating cuts. And yes, we've heard about Department of Education, and yes, we've heard about, maybe, the cuts to the NIH, but Eli's piece really digs a bit deeper and connects the dots for people who don't read beyond the headlines about what exactly is being cut and how that will detrimentally impact our children. Eli, thanks so much for joining me.
Thanks for having me here.
Okay, Eli, so your article kind of just is every paragraph is a horror story. And some people might say, all right, you're exaggerating, Trump administration's war on kids. Nah, it's not that bad. Talk to us about specifically why these Doge cuts, right? And we're only about 3.5 months, well, less than 3.5 months into this administration, how they're directly impacted to the health and future of our children.
So I think a lot of people are having trouble keeping track of it all. It's so much chaos across all these different agencies, and there's cutting here and there's cutting there, and there's already a lot of fatigue from this, even though we're just 100 days in. But what we try to do is show how across several agencies, including larger agencies, but also relatively little known, almost anonymous agencies like the Office of Child Care and the Office of Family Assistance and the Office of Child Support Services. Agencies people might not have heard of, how kind of across the government there's been this trend line of cutting programs and services that help children. And so, I mean, just some initial examples are like the Office of Child Support Services is housed within the Administration for Children's Families, which is housed within HHS, and kind of little noticed among all the cuts at HHS that Robert F. Kennedy Jr. was doing a couple of weeks ago. A lot of attention was paid to the health cuts, like on the health side of the agency, but there's also offices over on the human services side that include like the Office of Child Support Services, which runs the nationwide databases that helps state child support enforcement find parents who owe child support and get that money to families and kids. And child support's a pretty not a nonpartisan issue. I mean, this is like getting money to um, uh, families and kids that need it coming from the other parent. That's not going to be possible with all of these staffing cuts at that agency. Or over in DOJ, there's an office called the Office of Juvenile Justice and Delinquency Prevention, another mouthful, that a lot of people don't know about, but it provides all these grants to local law enforcement and nonprofits and victims organizations that help do things like respond to missing children's cases, um, investigate internet crimes against children, child abuse, things like that. So in all these different places, there are things happening that affect children that aren't just, kind of the liberal coded things like cuts to safety net programs and childcare, but also cuts to law enforcement in ways that harm children.
And the timing of this, each time I do one of these, I always tell our audience, I couldn't have planned it better, and I get no joy in saying that because as we're actually recording this on a Friday afternoon, we just got some breaking news about Trump unveiling his budget, seeking $163 billion in cuts, right? And a lot of these programs are the programs that you mentioned, but there's going to be increase in defense spending. Yes, yes, somehow always magically increase in defense spending in the military industrial complex. But the way they're trying to sell this, and it's not really being bought by the public right now, because if you look at the poll numbers, is oh no, we have to cut this because government is too big, it's too wasteful, it's too inefficient, and we should just punt these services to the state. For someone who might listen to what you just said, and we're going to break down just kind of the egregious, I would say just cruel cuts to some of these services that you mentioned in your piece, your response to that person who would say, well, government's wasteful. It's not the government's job. This should be the responsibility of local municipalities or the state.
Well, a couple things on that point. Number one, these programs do an awful lot on not that much money. And these are small agencies that serve children that are located across the federal government. And the amount of money that they spend to do things like maintain child support databases or oversee child care programs to make sure child care facilities are safe, or help local law enforcement with efforts to find missing children, things like that. These are very important programs, but they're compared to defense spending or the amount of the tax cuts that are being considered, it's small amounts of money. So I guess that's just one point. And then the other thing is that like this idea of returning it to the states, well, in a certain way, the Trump administration has been doing the opposite. I don't think this has gotten much attention, but a lot of the cuts at multiple of these agencies, a through line has been that they've been cutting all the staff out in their regional offices. So like people, partly due to Trump's rhetoric about kind of like draining the swamp in DC. I think people have this impression that the federal government is just in Washington, DC, but really it's spread out across the country. And most of the people that they've been firing have been those people that are spread out across the country. And so why do I bring that up in the context of children? Well, it's mostly those regional employees that would actually have relationships with local child care and Head Start facilities because they knew the area, they knew the people at those programs. It's mostly those regional employees who knew how to help local child support program officials enforce child support. And so like those are the people spread out across the country who are being fired and who are going to make all of these local programs function less efficiently. That these programs that serve children, and that now more of the power is going to be consolidated with political appointees in DC making decisions about children's programs from that perch. So I don't think they actually are returning anything to the states.
Yeah, and I'm so glad you made that point because we've seen like what 200,000, like hundreds of thousands of federal employees have been fired. Obviously, going to be devastating for the economy. Those people are without jobs, without health care. They can't spend money. But an important point is a lot of people think it's just concentrated in the DMV, DC, Maryland, and Virginia. But no, a lot of federal employees are all across the nation, right? So when you start gutting these programs, these institutions, you're gutting jobs, but you're also hurting kids. And one of the institutions, which has been a long-term plan for the Republicans to completely decimate, it was the plan of Betsy DeVos, Trump's Secretary of Education, during his first term, and it was the plan of Linda McMahon during the second term. They were successful. Was essentially the dismantling of the Department of Education, right? And many people say, it's bureaucracy. You talk about in your piece how the gutting of Department of Education directly impacts kids. Can you connect the dots for the viewers?
Well, there's a couple of ways. One is that the Department of Education does provide funding. So, for example, they were distributing pandemic relief funding that was going to things like tutoring services for kids who had fallen behind during the pandemic, or for making the air safer to breathe and the water safer to drink for kids in Flint, Michigan, where the schools were crumbling and they needed new water fountains because of the water crisis there and things like that. So that money that was being allocated by the Department of Education that the Trump administration has now rescinded. And so now those projects can't go on, those projects that serve children in a very direct, concrete way. And then there's also this threat to funding for Title I schools, which are schools in lower income areas, if they practice DEI in some way, which whatever your views are on DEI, it would still be a clawing back of funding from schools that really need that funding. So,
And also, let's be honest, DI, the way they've interpreted it is Jackie Robinson, Navajo code talkers, Enola Gay, because it has the word gay in it, even though it's not gay, it's the name of the bomber, right? Planned Parenthood, African American History Studies. So DEI could be a catch-all for literally, you can use DEI to attack any school, essentially, from their interpretation.
right. So, and based on that broad interpretation, clawing money back from schools that really need that funding. So that's a concrete consequence. These are schools with a lot of lower income students. And then I think probably one of the biggest things that the Department of Education does is its civil rights division and monitoring what happens to students with disabilities and making sure that they have services provided for them and that they're not mistreated and that they're treated equally and fairly with the services that they need. That's overseen by the Federal Department of Education, and that's a major function that would go away.
And also, folks, disability and those who are disabled also are included within, wait for it, DEI, including disabled children, also including many veterans who are also losing their jobs because they got the VA. There's an aspect of, I'm glad you mentioned RFK and the HHS, right? There's an aspect of HHS because a lot of people don't know is that RFK is also basically in charge and overseeing Medicaid. And we're seeing this attack on Medicaid and Social Security. But oftentimes people don't connect the dots about how Medicaid and Social Security are also vital lifelines for basically the protection of children, right? Like feeding children, keeping children alive, helping those households. Talk to us about this attack on Medicaid vis-a-vis HHS and how that directly impacts our kids' health.
Well, the biggest attack on Medicaid seems like it's going to come in the Republican reconciliation bill, where as much as $880 billion in cuts to the program are being considered. So that would be absolutely devastating to healthcare for children, children who have cancer, children who have disabilities, children who receive healthcare at their schools, or children who are in foster care. I don't think people understand about Medicaid that the age group that receives or that has Medicaid health coverage in the highest numbers is children more than any other age group. And so it's nearly 40% of
Mm.
um, Medicaid beneficiaries are children. Um, and so that, I mean, all these things I've been talking about would pale in comparison to if there was that level of cutting to Medicaid, that would really dramatically affect children nationwide. They'd lose their health coverage. And then you mentioned Social Security also. That's another one that I don't think people understand affects children. So
Yeah, they always think, oh, the elderly.
right. I mean, that's like the classic Social Security program, but Social Security also runs other programs, including SSI and SSDI benefits, which are or SSDI. They provide a basic benefit amount to families where if someone has a disability, right, a severe disability that prevents them from working, and there's often children in those families, and they rely on that as a source of income to be able to put food on the table and pay rent. And then separately, there's also survivors benefits, which a large group of children rely on those. It's when somebody in the family dies and their social security is supposed to go to their survivor, essentially, which can often be a child, or including children in foster care who have lost parents. Um, so the attacks on Social Security affect children, even though people just think of old age retirement benefits.
And these are kids, folks. These are vulnerable kids. Last time I checked, they're not working. But unless in Florida and Alabama now, they've lowered the age of child laborers to disastrous results, as you can imagine. And now you have Republicans saying, well, even though I grew up with a silver spoon in my mouth, these kids these days, they're too woke and they're too pampered. They need to, work in the coal mines and, just earn their way, right? But you also need, I don't know, maybe food, maybe healthcare, maybe education. Another aspect of this, which is just so cruel, because you're just listening to this and like the immense cruelty of adults who are privileged and wealthy, just decimating their children, like the youth, the most vulnerable, right? This is what's about to happen and is happening in this administration. Talk to us about their attack on Head Start. What is Head Start? What does it do, and why it's so vital to so many kids, so many kids who don't have the privilege of so many Republican elected officials?
Right. This is good. This is probably going to be the most imminent harm, and we're already seeing Head Start programs closing because they can't access their funding, which I'll explain in a second. But to answer your question about what it is, so Head Start was a program created during the Great Society under Lyndon B. Johnson, basically to provide pre-K education and childcare sort of at the same time to the children of working parents. And it's been a hugely successful program in terms of readiness for kindergarten and academic outcomes, but also in terms of providing childcare to 1 million working parents across the country. There's a Head Start location in every community across the country, and if Head Start locations were to start closing, which many already have, and also the Trump administration proposed budget proposes to eliminate the Head Start program altogether. So if Head Start programs start closing, that would especially affect rural working parents where often the Head Start location is the only child care facility in their whole town. and they just wouldn't have anywhere to send their kids during the day if that Head Start location weren't to be funded. So what we're seeing already is the Head Start program directors, when they've already, the money has already been appropriated by Congress and audited by nonpartisan civil servants, but now DOGE has this defend the spend website that every time a Head Start program director has paid a teacher or purchased school supplies, they have to go on the defend the spend website and justify that spending, and they're having trouble with that process, and they're having trouble accessing their funding, and some of them just like aren't able to stay open because they don't have their funding. And then on top of that, several programs grants are being renewed, annual grants that they get on May 1st and on the first of every month, and they're just like not sure if they're going to get that funding because everybody's been fired at their regional office of Head Start. So they're just in a state of confusion, which really affects the delivery of childcare. I'll add as one last point, because it's already a very precarious industry, as you probably know. Like
Yep.
there aren't enough childcare locations around the country to meet the need of families. They're very expensive. The teachers and caretakers aren't paid very much, and it's already kind of like a precarious job that and people are sort of ready to leave as soon as there is a sign of further insecurity. And so um, putting childcare into further uncertainty the way that has happened so far is already damaging childcare and Head Start in a way that some of these other harms are a little bit further down the road, like to Medicaid, for
And
example.
and also, the attack on immigrants, who takes care of our elders, right? Who oftentimes takes care of our children? Who does the jobs like you mentioned that no one wants to do but does due to desperation or due to like love for community, underpaying jobs. A lot of immigrants, a lot of people are here both legally and undocumented. And the attack on immigrants now, compounded by the attack on these programs, which are very popular and a necessary lifeline for families. Eli, just you're a reporter, but you can connect the dots. Like just if you can, right? I'm asking you. We will see in 6 months, but just tease this out, right? If they're successful in these budget cuts, and they're already unfortunately been successful, what does America look like in a year from now?
Oh,
Or let's
um,
say 6 months. Let me go. Let's not go super Nostradamus. 6 months from now.
well, as you kind of alluded to, as ProPublica reporter, where I'm more in the business of investigative reporting about things that have already happened and harm that's already occurred rather than kind of like trying to make predictions. But I mean, I do think it does look like I know that Republicans in Congress are still there's some that really don't want these big cuts to Medicaid because they know how many people now rely on Medicaid. It's become as popular of a program as Medicare, which didn't used to be the case. Um, but so anyway, my point is there's still some debate around that, but it looks like there's probably going to be very steep cuts to Medicaid or a transfer of the responsibility for paying for Medicaid to states, and states are already super underwater with their budgets because they've lost pandemic funding. They've done big tax cuts. They have to balance their budgets every year, unlike the federal government. So they're not going to be able to make up this money. Um, and we're going to see if there are these cuts, we would see rural hospitals closing, which would have all kinds of impacts on children's healthcare and also just like the economy of these communities. We would see loss of healthcare on Native American reservations for sure, loss of healthcare for children in school settings and in foster care and institutional settings. So those ramifications, I think, are pretty clearly predictable if we do see Medicaid cuts or some version of shifting the burden of paying for Medicaid to the states. And then, in terms of the effect of these other cuts, like at some of the other programs I've mentioned, I've talked to some child support experts and child support officials who said that like child support systems could start to fail because they fired all the, or not all of them, but they fired a lot of the IT people that run these complicated databases that contain child support information, and they fired a lot of people in the regional offices that work with local child support officials. So you could start to see um, families not getting their child support payments or not getting them on time or not getting the right amount, or parents who owe child support not being notified. All of these functions that typically happen smoothly and behind the scenes, just kind of like not working anymore because of the people who've been laid off. I mean, I could keep
No,
going.
it's a laundry list. I mean, it's I appreciate you spending the time because it's just common sense, right? If you just connect the dots, you see the direct negative, almost immediate impact on so many communities, especially rural communities, right? Often, not always. Many of them vote for Donald Trump. So it's almost like this self-destructive policy where Republican officials are harming their own base. And you are an investigative reporter, you follow this. I am curious if they must know what they're doing. What's the rationalization for it? Because once they realize, oh, this is going to impact my base, my community that I grew up with, my voters, they're going to literally die, become sick, be desperate, lose access to healthcare, be more stressed because they won't have resources to help their children. What's their justification?
Well, in terms of their approach to their own voters, I'm not entirely sure, but I do think that a through line with the attacks on programs and services for children is not necessarily that there's like some animus toward children specifically, but I think it's when you go into government with an approach of just cutting, cutting, cutting as much as you can, the easiest places to find cuts without as much resistance are going to be programs and services for children because they don't vote. I don't think it's a
Mm.
coincidence that the other agency that's been kind of most decimated is USAID, which is also not entirely, but largely serving people who don't vote in this country. And so it's easier to go after these programs that don't have these constituencies that are going to vote regularly and that have all these lobbying groups. Like they're definitely going after Social Security, but they're not making huge cuts to benefits yet or anything like that because in part because it's such a sensitive issue because like the AARP and these groups like that can rally just millions and millions of active voters, and people who are really involved in politics to resist those efforts. And I think that that's been not just during the Trump administration, but across history, it's been easier to go after programs that affect people who don't vote and don't have these powerful ways of advocating for themselves.
I don't know if you've seen that poster or that meme of Michael Jordan, and it says, F them kids. And I read your piece, and I'm like, yeah, might as well just have the Michael Jordan meme, F them kids. That's what's happening right now. Children don't vote. Most of them don't work unless, of course, now they're in some red states like Alabama or Florida where they're lowering the age to start working. But the rest of us do vote. The rest of us do read. We have to be informed. And when more and more people are informed about what's happening, you see more and more people wake up. You've seen the polls have just dramatically shifted against Donald Trump and Republicans when more and more people realize, oh, whoa, well, they're going after Medicaid, Medicare, Social Security, deeply unpopular. But people need to actually be informed. And Eli, that's what you did with your fantastic reporting. Eli Hager is the ProPublica reporter, investigative reporter who writes about issues affecting poor and the working people across the country. Eli, shamelessly promote yourself. How can people support you? How can people find you? How can people give you tips?
I can definitely search my name, Eli Hager, and ProPublica, which is a nonprofit, nonpartisan investigative news organization. And you'll see my phone number and my number on Signal if you're a federal worker wanting to share something that has to do with the federal social safety net programs that I've been covering, including ones we've mentioned like Social Security, Medicaid, also SNAP is a big one. I'm trying to report on those things, and you can contact me privately and confidentially on Signal or email me. Can also on that same page see the work that I've been doing recently.
Yeah, you can voluntarily add him, not like Mike Waltz and Pete Hegseth
Oh, yeah.
accidentally inviting Jeffrey Goldberg of The Atlantic. Or, sorry, he was sucked into the phone. Eli, thanks so much for joining us, folks. This has been an interview for The Left Hook. No paywalls here. Pay what you can. Thank you for supporting independent journalism. Support ProPublica. They're doing fantastic work. Stay safe, be kind, and please, oh, please, don't be a fascist. Take care.